are so effective in anxiety, because all that you can do, all the cognitive therapy in the world that you want, but unless you get that body in line, you're not really going to fix that anxiety.
My goodness, that sounded a bit like a chiropractor there for a minute.
Well, you know what? I got Dr. Nima Rahmani's a really good friend of mine. We talk just about every day. So he and I kind of blend back and forth. I do have a very open way of looking at, medicine. I am a hardcore scientist as well. I am a hardcore MD when it comes down to some things. But, you really have to be able to talk to people. And I think that's where the alternative health, I even don't like using that term, chiropractors, naturopaths, that kind of stuff. They have typically a better way with patients than we do as medical doctors. And I think there's a number of reasons for that, which could be an entirely different podcast. But, you really do need that healing kind of words from your physician. It's not just a matter of, okay, this is what you have, this is what we're going to do about it. And I think the chiropractors and the naturopaths and the alternative health, the non-allopathic MD doctors, are a lot better at that in general than the medical doctors. And that's evidenced by the amount of money that's spent in the United States on non-allopathic medicine. In 2015 or 16, I can't remember the exact year, but the spending for the first time eclipsed what it was in allopathic medicine to the sort of naturopaths, the chiropractors, the alternative health practitioners. They're making more money than the medical doctors are now, because I think they fundamentally have a better rapport with patients. I mean, there are great medical doctors out there. I've met tons and tons of them.
For sure.
But I've also met medical doctors who are pretty, they're more like technicians. They're more like, okay, well, this is wrong with you. This is what we're going to do about it. And there really isn't that human connection that really engages that social engagement system that invokes that placebo effect, if you're even going to use that. You need that to really heal. It has to be sort of a multifactorial thing. A doctor isn't just someone you can plug into, your symptoms into a computer and they spit out a prescription.
Absolutely.
Anyway, I'm getting all upset.
And that physical component, separating the mind from the body, it is impossible. I mean, we are an integrated system, and as a chiropractor myself, I mean, I see that when we adjust people and their sympathetic nervous system can re-equilibrate, then they can be available to some of those other opportunities to heal. And we may not be treating their anxiety in any way, but we're giving their body a chance to reset, and therefore giving their mind a chance to open just a little bit to let that in, which is a wonderful combination.
Yeah, and that's what you need to be a true doctor, I think.
It's not an either-or game, and I think it's great that we seem to be moving a little bit more into that, which is wonderful. So treating anxiety, it hasn't been particularly long-term effective. Is there a reason for that?
I think the reason for that is that we, focus on the mind so much. We assume that the mind is the nervous system, whereas the mind is just a component of the nervous system. We assume that our thinking is actually who we are, and that's actually not the case at all. And we don't really incorporate the body in the healing of the mind. And this is true almost across the board among healers, is that typically it's kind of, you go for psychotherapy. You go in for, if we talk out our problems. And as human beings, we really do have to talk out our situation to be able to understand it. We have this huge